our research that I presented at the European School of Hematology CLL conference was on functional testing of PI3 kinase inhibitors. And the objective of this study was to test if CLL cells that have become refractory to the PI3 kinase inhibitor idelalisib can still respond to other PI3 kinase inhibitors. So in the study, we looked at 10 different PI3 kinase inhibitors, including idelalisib and Duvelisib, which are approved for CLL. We also looked at Umbralisib and some PAN inhibitors, including Copanlisib. And to see the responses in CLL cells, we included cells both from treatment-naive CLL patients and from patients that have become refractory to CLL. And we did see that there was reduced sensitivity in the refractory CLL cells, but especially PAN inhibitors were still active in these cells, so indicating that there is drug class activity even in idelalisib refractory CLL cells. And we were also able to look at combinations with Venetoclax, and we saw that there was synergy between the different PI3 kinase inhibitors and Venetoclax in CLL, and also that these combinations were active in idelalisib refractory CLL cells. And this led us to a patient case where we had a patient who had unmutated IgHV and TP53 mutations, so poor prognostic markers. And she had received already several lines of therapy and used all the available treatment options in Norway. And therefore, we decided to do a drug sensitivity testing on her CLL cells. And we were able to see that the cells still responded to PI3 kinase inhibitor plus Venetoclax combinations. And based on that, we treated her with the idelalisib plus Venetoclax. And it was nice to see that she received a partial response. But unfortunately, she experienced intolerable adverse events and the treatment had to be stopped after 3 months. But then we could do drug sensitivity testing on later samples, and we could see the evolution of cell signaling and drug sensitivity. And it was interesting to see that, for example, ERK was activated when the disease relapsed, and this was reflected in increased sensitivity to MAP kinase inhibitor plus Venetoclax combinations. But unfortunately, we could not test these alternative therapies on the patient because she was becoming too sick to receive therapy. But our findings indicate that there is possibility perhaps to use other PI3 kinase inhibitors in idelalisib refractory CLL, and also that drug sensitivity testing can guide personalized treatment. So we would like to follow this up with studies on larger patient cohorts and also clinical trials.